and that session will be chaired by Dr. Varalakshmi Manchana. And this Varalakshmi Manchana is an assistant professor at the University of Hyderabad, India. She completed her PhD from Rajiv Gandhi University of Health Sciences in Ages within Indian Nursing Council. Her research interests includes aging and health, adolescent health behaviors, NCDs, women's health, child injuries, and social behavioral health with the gender lens. So thank you so much, ma'am, for kindly agreeing to chair this particular session. And in this session, we have, so I think, 7 to 8 presentations. So I hope that will be very hectic for you, but I'm sure that you will be able to manage this. So I now request you to kindly chair this session. Over to you, ma'am. Thank you.
Okay. Thank you, Professor Dhananjay, for your invite to me to be part of this, as well as your kind introduction as usual. So thank you. Before going forward, so this session includes looks like a little the last technical session as well as little longer technical session, having a 7 to 8. So all of you are, I'm expecting all of you are patient enough to bear with, and I welcome all the presenters also. And the session looks like it is a combination of combination like somebody is presenting about the quality of life as well as social and gender disparities, happiness and cognition, and also some of the therapeutic strategies. So I welcome you all, and shall we start? Before starting, I would like to say that each presenter has 10 minutes time. Please stick to your time. So the next presenter will be waiting for their turn. So let us take the questions by the end if somebody has. In case if it doesn't have, they will be posting their questions. So you will be forwarded and to share their answers later on. So please, shall we move on with the first presenter, Paramita Majumdar. Is available?
Madam? Yes,
yes.
Ma'am, am I audible?
You are audible. Please share your screen, and your presentation is for 10 minutes.
Yes.
Please go ahead. Please go ahead.
So, good evening, everyone. At the outset, I'd like to convey my regards to the organizers, the esteemed panelists. So, I am Paramita Majumdar, and I am a PhD fellow in International Institute for Population Sciences, Mumbai. Today, I'll be presenting on my topic. It will be a short presentation. It will be on regional variations and determinants of quality of life among older adults in India, insights from LASI Wave 1. So starting with the presentation. So I'm not going to present any figures because it is very much well established that longevity has increased across the globe and aging is a global phenomenon. Rather, I can say that it is our global future. So the first thing that we have to keep in mind is that we have to fulfill the needs of our older adults. We have to fulfill the needs of this aging population. And the first step towards fulfilling these needs is to have an overall idea about their condition. So their needs can be various. The first, they can have some physical needs, some psychological needs. They can have some financial needs. Then there is safety concerns. There is social needs. So they have several kinds of needs. And there are several metrics of understanding those needs or understanding their needs and understanding their aging experience. But one important metric is quality of life. And as WHO defines, quality of life is an individual's perception or individual's assessment about their position in life, and very importantly, in the context of the culture and value system in which they live, and about their goals, expectations, standards, and concerns. So if you talk about India, India now has more than 100 million older adults, and the projected figure says it is going to increase in future. And along with that, there are multiple geographical regions in India: North India, Eastern India, Western India, etc., etc. And each of the regions, they have their own socio-cultural and economic unique socio-cultural and economic environment which can influence the aging experience. So the objectives are very simple. The first objective is to get an idea about the quality of living or the quality of life of the older adults and what is the condition of the various domains of quality of life. And the second thing is to understand the factors that are associated with quality of life. So for data, we are using LASI wave 1 data. It is as of now a cross-sectional data, and the study population is older adults aged 60 years and above. The final sample size is 30,507 older adults, covering the entire of India, several regions and all the states. Descriptive statistics are there to get an idea about the estimates of QOL. And in terms of statistical analysis, bivariate analysis and regressions have been performed, which were performed in Stata 16 software. Now, if we look at our main outcome variable, which is quality of life, which has been constructed based on WHO's guideline, which is called the WHO QOL BREF, which has 26 items, but since it is a secondary data set, there are certain data limitations. So we have restricted to 24. So the major domains are firstly the physical domain, having information about the activities of daily living, the energy level of the respondents, information about pain, sleep, etc. Then in psychological domain, we have self-esteem, spirituality, positive and negative feelings. Then there is social domain, containing information about friends and family. Then there is environmental domain, containing information about finance, safety. And along with that, we have two additional domains. One of their overall health, where we are using self-rated health, the variable. And the second thing is getting an idea about their life satisfaction. So, and we have several covariates or predictors, which there are some individual factors as well as community level factors. And along with that, we are also including two very important covariates. The first one is household decision making, and the second one is participation in various social activities. Now, moving on to the findings, we can see the graphical presentation of the findings, and we can see in all the domains there are certain regional variations present. So to summarize this entire graphical presentation, I can say that the overall mean or the overall average QOL or quality of life score is around 70, but it varies across regions. And if we see the domain, in physical domain, the highest quality of life score is with South India, and the lowest is with Eastern India. Similarly, in psychological well-being, we can see West India is outperforming all the other regions, and it has the highest average score. Then social domain, in social domain, we can see the Northeast India has the highest score and other regions are far below. Then there comes environmental domain. Again, Central and Eastern India have the lowest scores. And the additional domains, which include general health and overall life satisfaction, we can see that West India has the highest score and is far above Eastern India, which is the worst performing region in terms of this additional domain. So regional variation exists in all the domains of overall well-being, and this regional variation exists in the overall quality of life score as well. Now the second thing, the second set of findings, it is from the what are the factors that are associated with quality of life. So we can see that quality of life scores were relatively lower in females, in those who never attended school or those who are not married and those who are currently not working. The second finding is that quality of life decreases as age increases. And the third is that from a life course perspective also, it can be seen that childhood factors like childhood health is also significantly associated with one's quality of life towards the end of their life. And another set of findings is that with decision making and social participation, so when decision making or when the individual participates in intra-household decision making, his or her quality of life tends to increase. Similarly, when the a respondent is participating in social activities, various participating in games, sports, or participating in some social events, their quality of life tends to increase. And when we did the bivariate analysis of this decision making and social participation across regions, we found some similar results like quality of life. That intra-household decision making is highest in Northeast India, which also has one of the highest quality of life scores. Then again, social participation scores, although it is lower in all the region, East India has the least score and West India has the highest score. Similar results were also found in the bivariate analysis of overall quality of life score. So we can see there is some kind of association between social participation, decision making, and quality of life, which our regression results are also supporting. And so what can we infer from this result? The first thing is that since the regions are quite varied in nature because they have their own distinct socio-cultural context, the aging experiences of older adults varies. And when this aging experience varies, their quality of life also gets impacted throughout. So findings indicate that the distinct socio-cultural context of different regions significantly influence the aging experience of older adults. So this is an important finding. The second thing is that I also like to highlight some challenges of working with the quality of life variable. So we know that there are a large number of measures like successful aging, healthy aging, active aging, and then there is quality of life, and all of them have several cross-cutting domains. But what quality of life does is that it gives us a summary or a concise overview of the aging experience of the older population, and this is an advantage of quality of life. But we have to be very careful on what we are prescribing in terms of policy, because all these other measures are also existing and the domains often clash with each other. And if we see the domains, second challenge is that if we see the domains of various domains of quality of life, some domains are affecting other domains, means there is some interrelationship within the domain, like the financial domain may affect the health domain. So it can impact the regression results. And the third thing is that there is no standard procedure of implementing this WHO QOL BREF scale of.
Paramita, excuse me, please wind it up. Can
Yes,
you
ma'am,
conclude?
this is the last. Yes, ma'am,
Yes.
this is the last slide. This
Please
is the last
conclude.
slide.
Yes.
Yes, ma'am. So there is no standard procedure for implementing this WHO QOL BREF through secondary data sets. And so there is a lack of comparable estimates. Estimates may vary from studies to study. And the last point is that the reference periods of some of the domains are different. Like for energy, it is taking information for past week. For some other variable, the information is taken for past 1 month. So when the reference periods vary, it may affect the estimates also. So that's all. Thank you. So if you have any query, you can.
Thank you, Paramita. So we have seen your exhaustive information from the LASI about the quality of life, and that is also giving the insights to the other presenters and other also prospective interested candidate that the factors involving the regional differences can be a future research also. Thank you.